as a young person, I need good and quality education and support from my parents and whoever is related to my school education.
Lo que quiero para mi bienestar ahora es un país seguro para mi familia, para mí, para mis seres queridos.
I need to have access to free sexual reproductive related services and the available youth-friendly healthy corners in our communities.
My dream in life is to have a successful career where I am in a position to help others and make change.
I think as young people, we don't want to stop. We really want to talk about our rights and our opinions, and to be able to get platforms where we can really voice our concerns is the biggest thing that can happen to us.
Our goal and our wish is to have more young people in decision-making processes. Unfortunately, we have a very low participation of young people in these tables of decision.
Hola, mi nombre es Nico Gómez, tengo 23 años, soy síndrome de Down, soy deportista de alto rendimiento. Vivo en Bogotá, Colombia. Mi sueño es ser campeón mundial de mi país, de paranatación. Quiero pagar mi seguridad social, tener independencia económica.
Good evening, everyone. Friends, colleagues, distinguished guests, welcome. Welcome to this event that puts accountability for adolescent health and well-being at the center. Colleagues, we are meeting at a defining moment. The global adolescent and youth population is growing, and with it is the responsibility to ensure their health, rights, and well-being are more urgent than ever. We meet in rather challenging times. We meet at times where there is a rapid decline in available resources to invest in global health, and even lesser that is available to invest in health of adolescents and young people. We meet at a time when there is rapid acceleration of regressive policies that are being implemented that undermine the health and well-being of young people around the world. We also meet at a context that we know 21 million adolescent girls in low and middle income countries become pregnant every year. We do know that 1 million adolescents die annually from mostly preventable causes and mental health conditions. We know at least 1 in 7 adolescents globally now suffer from mental health disorders. The question we really should be asking, if we know all that, why are we not doing something about it? Colleagues, this is a journey that we have been at the Partnership for Maternal, Newborn and Child Health, thanks to the championing and support of several of you in the room, to not only just develop evidence that is needed to make a case for the imperative to address adolescent health and well-being, but actually articulate how we can transform policy to implement that. We have documented today not just what is needed to be done epidemiologically in terms of adolescent health and well-being framework, but we have also demonstrated the phenomenal costs of inaction. And I'm not joking. The costs of inaction today, the returns on investment, stand at $4.1 trillion. If it's not the health and well-being, surely the economic case makes sense to people. We have new evidence being released in less than 24 hours' time with the second Adolescent Lancet Commission report that will be unveiled just down the road. We want to hear from you today, not just what the problem that we are facing, but what are the solutions that we need to be addressing. We have an extremely rich lineup of speakers, and I would really be starting my conversation today by requesting them all to try and keep on time, because we do want to hear from all of you, and most importantly, you want to hear from each other as well as we walk through. And with that, I would like to invite Kanisha Arora, Youth Representatives to the SDG 4 High-Level Steering Committee, to deliver her opening remarks. Kanisha, over to you.
Thank you so much for that warm welcome. Honored guests, distinguished leaders, and passionate advocates. Namaste, bonjour à tous, and hello. Today, we are standing at a crossroads. The crossroads between what has been and what could be. We're standing in a moment where we must choose to turn promises into progress and vision into victory. But as we gather here today, I ask you all, what does accountability look like? For me, accountability is not a distant bureaucratic term. It is a promise written in the dust of a classroom floor where a teacher, paid too little, caring too much, will not let any child fall behind. It is the weight of a doctor's gaze into the child, asking behind every test, behind every diagnosis, that there is a life that must not be forgotten. Accountability to me looks like a mother who knows that her daughter will not die giving birth in a clinic because she has access to safe care. It looks like a young boy who can find space to talk about his mental health without shame or fear. So it's not a policy that lives in the pages of a report. It really is the pulse of change that is felt in the lives of those that we serve. But too often, the promise of accountability is lost in translation. We hear about declarations and commitments, yet somewhere between the words spoken and the lives affected, something is lost. These promises turn into echoes, and data becomes disconnected from the faces that it very much represents. That is why today we are here to talk about accountability. We're here to ask not only what is it, but what will we make of it? We will not allow accountability to just be another checkbox, another target that fades into the background. We will make it real, visible, and unyielding. And to do this, we must recognize that accountability does start with us, with each of us in this room. It starts with the courage to ask the hard questions, but also the integrity to ensure that the answers are not just words, but actions. So what does it look like? It looks like governments not just pledging to protect adolescents, but to prove it by funding mental health programs, by ensuring access to education, and safeguarding reproductive rights. It looks like international organizations that don't just host conferences, but build coalitions that last way beyond just the closing remarks. It looks like young leaders, like the ones in this very room, who don't just advocate for change, but become the very architects of it. But most of all, accountability is a mirror. It reflects our choices of today, our actions, and our courage to make a difference. It's not just something that we demand, it is something that we become. And as I stand here today, I'm not asking you to promise, I'm asking you to prove. To make your commitments visible, your progress measurable, and your impact undeniable. Because we cannot afford to let another adolescent slip through the cracks. We cannot afford to let our futures be left to chance. So I ask you, when you leave this room today, will you be able to look at yourselves in the mirror and say, I made a difference? Will you turn accountability from a concept into a reality? Because we're not here to talk about what could be, we are here to build about what must be. Thank you.
Thank you. Thank you so much for that, Kanisha. And my job this evening is to get you that answer. Colleagues, just to explain it to you how we will be going about it, we have two presentations, two sets of opening remarks, which will help us get through the evidence and the tools that we are talking about. And then we have two rounds of panel discussions. And I will do my best to make it as interactive responsibility lies on them to stick to the time. But do get your questions ready, because we would really want to hear from you as we walk through this conversation. So we are hearing a lot about evidence tools, diagnostics that are available, and WHO is at the forefront of a lot of this work that is being done. And Anshu, could we start with you to detail the recent guidance that WHO has developed, and how do we get the countries to use it? What can we do to facilitate its uptake? Over to you. Yep. That's on.
Okay. Thanks a lot, Rajat. And no, it's a pleasure to be here and at this launch of the guidance for countries to assess adolescent health and well-being. And this is not, let's say, it's been a process over the years and a partnership over the years. It's been the agencies such as UNICEF, UNFPA, UNESCO, UNAIDS, WHO, PMNCH, who've been working together in, first of all, developing a framework for adolescent well-being. What does that mean? And we identified a number of domains. That, of course, also led to updating the AHA, the Accelerated Action for Health for Adolescents, that came out, I think, Valentina, last year or 2 years ago. What? November 23. Of course, last year in this very room, we launched the gamma indicators, the 47 gamma indicators. Most of them, of course, focused on health, but there were also a number that focused on program implementation, etc. And based on that, and of course what came out of the COVID pandemic, the new issues such as already highlighted by Kenisha as well, mental health, came to the forefront for adolescents. We have the whole issue about use of AI, digital screening time, the impact of digital on well-being of adolescents, the climate change related issues. So it was important, I think, for us to sort of discuss and decide on, how do we move beyond health only and really look at well-being more broadly for adolescents, and what does that mean? So the guidance was developed through a multi-stakeholder process at countries. It was also piloted in 3 countries. In India, it was piloted in Colombia, it was piloted in South Africa, and that really helped us sort of finalize the guidance, but it's also not prescriptive, and the process is really to look at country level, what kind of indicators are available, what do you already have. So as part of the mapping of the 47 indicators that we identified as part of the gamma process, the action, let's say, that countries could do is to also look at what are the other indicators in relation to adolescent health, adolescent well-being that are available at national level within other sectors, and then look at that jointly and move that forward. So that's been a little bit the process. And, we as WHO, of course, and together with the other partners, it's a joint product, are more than happy to support countries to take this forward. It's very important that we have a multi-sectoral approach to this, and I think that's what the domains highlighted when we looked at the framework, the adolescent well-being framework. A big partner, of course, is the Ministry of Education when we look at school health. But of course, social welfare is also one. Nowadays, climate change, so a key issue to look at. And so that would be, I think, one of the key things is to support countries to set up a multi-sectoral kind of task force or working group to look at what are existing indicators at country level, and then really see what is available, how can we strengthen data quality, and how do we use it for action? Because, of course, in the end, it needs to lead to action and feed into national plans, be funded by Ministry of Finance, let's say, and then being implemented and monitored for accountability, as was highlighted.
Thank you. Thank you very much for that, Anshu. And laying it out so clearly that we cannot just leave at producing the guidance, we have to work through in terms of building the capacity and ensuring that there is uptake on that. David, over to you. You've been a champion all through for this work, and now with the Children's Investment Fund wearing a new hat, how do you think young people can meaningfully engage with the kind of guidance and tools that Anshu just talked about? And what role do you think institutions like yourselves, the Children's Investment Fund and partnerships, can play in making that happen?
Thank you so much, Rajat, for the opportunity to speak. And it's great to be back in Geneva and seeing so many friends again. It's been a while since I've been here. When you sent me the question for the panel, I was reflecting on my times as a young leader myself when I started this journey in global health. And I was thinking the work that we were doing with medical students on safe abortion, for example, organizing ourselves on the topic. And many of these guidances, they seem very far from what we were able to use at the time. But then there were organizations like IPAS, for example, who were able to translate this kind of guidance into something that was more tangible for young people and medical students, for example. So when I was thinking about how these kind of tools can be used by young leaders, youth organizations, I was thinking that something that they can be helpful is to build credibility for youth organizations, and also to build evidence that can be used to hold systems accountable. So I think that these two things are the things that resonated the most with me. I think that the data that can be produced by young people can lead to finding critical gaps when it comes to topics like mental health, that was flagged a couple of times, family planning, for example, safety, education. I think that when the evidence that is localized at the very, very local level, at the school level, community, universities, it can become a very powerful advocacy tool. Now, being more concrete on what I think youth organizations can use this kind of guidance for is monitor local realities to begin with, tracking implementation of policies, but also holding governments accountable for the lack of commitments that are not being fulfilled, for example. Using the guidance to also generate community-led new data, and also bring that back to decision makers, and then creating feedback loops, which I think that are incredibly powerful for young people themselves to be able to inform measurement process, are also so they can also be empowered to advocate, to monitor, and lead to data in action. In the case of what I think that organizations like, for example, CIF can do, and other funders in the space, is keep investing in this topic. I think that PMNCH has done a lot of work already. You mentioned, Anshu, the adolescent well-being framework, so we can all speak the same language. The investment case, so we know the cost of inaction, and also the return of investment. There's many things that you have already done, but there's much to do still. There's much to do. There's capacity building still that needs to be improved for youth organizations, for civil society besides, not only for youth organizations in general. Also creating platforms. And I think that the power of PMNCH to connect, to convene, and also to provide technical advice, I think that is priceless in the end. So definitely I think that from the funder community, that's a call to action that we can take forward. In general, I think that putting young people elevating the role of young people in these kind of spaces, and also in global health at large, is critical, and PMNCH has played an amazing role in this. And I'm a product of PMNCH myself. I chaired the youth constituency when I was a young leader myself, and also CIF. We invested in the youth constituency in the creation, and was catalytic to create it many years ago. So I think that it was a great full circle moment for me to be able to speak about these things.
Thank you so much for that, David. And really bringing home the point is, for us to stay the course and the need to continue doing that. And, you reminded me something that when I was working in HRP, colleagues on the adolescent health portfolio often said that our biggest challenge today is a lot of very good work is often just left at boutique level. We are never able to take it to scale, and we are never able to therefore show longitudinally the impact that we can actually achieve. Thank you so much, Anshu and David. We now move into the second part of the discussion, our first panel, in terms of what will it look like for us to address the accountability deficit. And if I could please invite Aradhana Patnaik from Government of India, Ministry of Health and Family Welfare, Lawasi Manzi from the Presidency in South Africa, Uswa Malik from Norway, and Dr. Flavia Busreo to please come up on stage. Thank you. Thank you all. Thank you for that, Mohit. That did get us the attention. Thank you all for joining us today. And as the theme of the conversation today is, how do we plug the accountability deficit? Aradhana, if I could start with you, please. Government of India, Ministry of Health and Family Welfare, has been at the forefront of digital health innovation and technologies that have been employed to use to advance healthcare agenda. How do you think we can use the same digital technologies to implore on ensuring real-time accountability?
Yeah, good evening to all of you. Namaste from India. So just before delving upon the digital health part, I would like to inform this August audience. I don't know whether all of you are aware, India is the country which has the largest cohort of adolescent population in the world. The second, and which is more important, is India has been a pioneer and the first country to have a separate national program for adolescent health and well-being. So to start with that shows the commitment at the highest level, at the country level, wherein adolescent health and well-being has been at the core of various initiatives of the Government of India. Now coming to digital health, basically through the Ayushman Bharat Digital Health Mission, a silent revolution has happened in the country with focus on the adolescent, not only the adolescent, basically through a life cycle approach starting from the pregnant woman to the child to the adolescent, and again the adolescent becomes a woman, again a pregnant woman and a child. So the entire life cycle, one can say, the digital platform is able to capture. We have a UVIN platform where the vaccinations are being captured. Through the Ayushman Bharat Digital Health Mission, basically every citizen of the country, including the adolescents, we track their electronic health records. Every person can track their own electronic health record. So that provides the continuum of care for any disease, be it communicable, non-communicable, including mental health for adolescents. And coming specifically to the programs for adolescent health where digital interventions have brought revolutions, one, as you are aware, we have the Rashtriya Kishore Swasth Karikram. That is the program for adolescent health, wherein there are various interventions. We have adolescent-friendly health clinics for the adolescent, for looking at the needs of the adolescent people. And for the youth, we are able to track, the counselors are able to track each and every adolescent while he or she is going through his or her own cycle of, mental issues or psychosocial issues. So the entire thing is on a digital platform which is being tracked. We have a school health and wellness program where again digitally each and every school adolescent, girl as well as boy is being tracked, and their health issues, their health records are maintained. Apart from their physical, their mental, their psychosocial, entire well-being is being monitored. So all these platforms, for every program there is a digital platform. And at the core of the entire, all the programs which come under the National Health Mission, at the field level, one can say we have the Ayushman Arogya Mandir, the Ayushman Bharat Health and Wellness Centers, now have been renamed as Ayushman Arogya Mandirs. These are at the community centers where basically all the issues of adolescents, including their various, the issues that come to them on a daily basis are being addressed at the Ayushman Arogya Mandir through a digital platform where all the diseases, communicable, non-communicable, be it TB, be it malaria, be it adolescent pregnancy, everything comes under the digital platform. So I think through that we are able to track and also provide the care, the counseling, the care, whatever intervention is required as per the needs of the adolescent. So that in a big way is helping the adolescents. And one of the recent interventions I would just like to mention at the end, for tuberculosis, we have just recently come up with AI digital handheld X-ray devices, wherein closer to the homes of the people, to the citizens, even adolescent children, the girls, boys, all of them who are prone to tuberculosis also, they can be easily detected, screened, detected, tracked, treated and taken care of. So through this, I think lots of, and all these measures prove the accountability measures that are being taken by the government, and we are hoping that we'll go a long way and we have always led by example, and many countries are now copying our various initiatives, and we would love to share those initiatives with all of you. Thank you.
Thank you very much for that, Aradhana. And remarkably, how digital technology has been used in a transformative way to track progress across different initiatives. And I have often talked about the UWin app as one of the game changers, which can actually be a source of inspiration for other such countries as well. Moving from India to South Africa, Lawazi, as you know, South Africa has made enormous progress in terms of aligning with the adolescent health and well-being framework. And one of the most remarkable features of the work that your colleagues in the presidency, such as Professor Rose Summers and others have done, is bringing an all-of-government approach across sectors. How did you do it? And what can others and partnerships help us do it further? Microphone, please.
Thank you so much for this opportunity. Good evening, everybody. Now, full disclaimer, just you can pretend I'm the Minister of Health because he was supposed to be here, but I was asked to, one day is one day, but I was asked to replace him. I was given a script. But when I arrived here and I started to look at everything, I said, no, I'm going to ditch most of the script because there's something I wanted to say. So I'm going to read some of it. In South Africa, we have embedded adolescent health and well-being within a comprehensive rights-based policy framework through our National Adolescent and Youth Health Policy. And this policy is multi-sectoral by design, bringing together health, education, social development, and justice, because we recognize that no one department can address the full needs of our young people. So the question that the young lady asked us is, how are we accountable? And actually, what does all of these fancy languages look and feel like? How do we breathe and live it? Now, there's one, so I called my good friend Farid Abdullah. I think some of you may know him, because at the South African Medical Research Council, they are implementing an extremely exciting social impact bond. And I thought you might be interested to hear about it, especially in the context of all of the financing crisis that we're facing. Many of us are looking for innovative financing solutions. And all the things that Anshu spoke about, we are living and breathing through this social impact bond and innovating as we go along. In fact, I'm so inspired by what's happening at the MRC that I even said to Farid that I actually want to use this model for day zero financing for pandemics, but that's another story for another day. But here's what has been achieved through the social impact bond. And I said to Farid, he must send me everything very quickly now, and he did. And thank you very much to Farid. So the Imagine Social Impact Bond was started 2 years ago by the South African Medical Research Council in 14 schools in 2 districts from my home province, KZN. And the results in the last quarter have shown contraception coverage for sexually active girls is 70%. And these social impact, this program and this bond is being piloted in these 14 schools at the schools. So the services are being brought to the schools. The PrEP coverage for HIV-negative adolescent girls and young women in schools is over 50%. ARTs for HIV-positive adolescent girls and young women is 82%. Early antenatal care before 20 weeks gestation for teens who are pregnant at schools is 61%. And he's saying here that these are just tracer outcomes of a broader comprehensive health package delivered in safe spaces in schools. And discussions are ongoing with the Department of Basic Education to scale up this program to all high-burden schools. The program has been funded by Treasury with a program support funding from the Global Fund, and the Social Impact Bond rewards good performance against very ambitious targets. The bank that is holding the Social Impact Bond is the Rand Merchant Bank, and he's saying here that he wants to scale up. He's looking for partners, and he wants to share the model with other countries. So I said, well, I'm doing that right now for you, Farid. And the entire program has also been digitized because you need the data in real time. And the results were monetized each quarter, and the SAMRC brought outcomes to each quarter. So what has this program done? It has harnessed the multi-sectoral response. It has brought in the private sector, has brought in commercial banks. We're not very good at doing this. And kudos to Farid and to our Director General Sandile Buthelezi, because they went to Treasury and explained what the social impact bond actually is and what it can do. They didn't understand in Treasury. And here's the lesson here, is that don't think that just because you don't have the financing expertise, you can't actually go and speak to the financing sector about what you want to achieve. They went and they actually motivated for this. They demonstrated the multi-sectoral, harnessing all of departments and the whole of society approach. They demonstrated that this was going to be an outcomes-based thing. They spoke to our Treasury, they spoke to the bank, and these are the results. And everybody's happy. The bank is happy, Treasury is happy, everybody's happy, everybody's ready to actually scale up and move along. And to the young lady who was asking us how we're accountable, that is how you become accountable. These are the things that you were looking for. This is how young girls in schools are being protected. They are being taken through through the life course by really harnessing their own individual capabilities, and you're selling the fact that you're actually making an investment into this young girl who is at school, you need to ensure that they actually emerge out of school healthy and capable of thriving in the outside world. So thank you, Rajat. I hope this was helpful to help understand how it looks like when it's living and breathing beyond policy in action. Thank you.
Absolutely. Thank you. Thank you so much, Lavazi. And a remarkable example of how change can happen when we bring the different elements together. And moving from that remarkable example to you, Uswa, as a youth leader from Norway, if I was to give you a blank sheet of paper and ask you to pick 3 metrics for a scorecard, what would that entail?
For adolescent well-being?
Yes. Well, for world peace as well, but we'll start with adolescent well-being.
So, first of all, I must say that it is an honor to speak as Norway's youth delegate on a topic that is urgent for adolescents everywhere. Adolescents across all regions are trying to navigate what is the most formative years of their lives, all while facing structural gaps in systems that are supposed to protect them. And so when we're talking about adolescent well-being, we must talk about whether or not they feel safe, included, valued. And one of the first metrics that is absolutely non-negotiable is mental health access. And I know we talk about mental health a lot when we talk about adolescent health, but it just absolutely cannot be stressed enough, because mental health remains one of the most underfunded and undermeasured issues in adolescent health. And globally, mental health issues account for 16% of the disease burden among people aged 10 to 19. Yet, it still remains deprioritized in both funding, services, and even data collection. And mental health, as we know, affects everything from education, safety, and individuality, identity. Across all contexts, in Norway, in South Africa, in India. And so we must change that. And a scorecard must track access to adolescent-friendly mental health services, school-based mental health programs, because we're not just trying to measure how many psychologists and psychiatrists exist, but we want to know whether they feel safe from bullying, from digital harm, from social pressure. And most importantly, it must be youth reported and adolescent reported. The second metric must address the fact that that adolescents cannot thrive in environments where they feel unsafe, excluded, and invisible. And this includes adolescents who are facing displacement by war, climate crisis, economic collapses, those whose schooling is interrupted, whose care systems have broken down, and whose trauma far too often goes unnoticed in national data. But it also includes adolescents who face exclusion just because of who they are. Marginalized adolescents, girls from adolescents from religious and ethnic minorities, indigenous populations, LGBTQI plus adolescents, and adolescents with disabilities. So the scorecard must include exposure to conflict, displacement, disaster, access to essential services for displaced and refugee adolescents, inclusion in education, health, and public spaces regardless of identity, and legal protection against gender-based and identity-based violence. And we must remember safety is not just the absence of war, but it is the presence of justice and equal opportunity. Thirdly, as you mentioned, each year more than 21 million adolescent girls give birth, mostly in low and middle income countries, and for far too many this is not a choice, but it is a consequence of a lack of contraception, for a lack of comprehensive sexual education, and a restricted bodily autonomy. And despite decades of evidence, SRHR is still being politicized, underfunded, and in some places rolled back on. And we must measure access to contraception and safe abortion services, availability of comprehensive sexual education, both in and out of school, adolescent birth and maternal mortality rates, and legal protection and frameworks. And this data must be disaggregated by gender, age, location, and disability, because SRHR inequalities often hide in national averages.
Thank you very much for that, Usma. And three very, very clear calls, mental health, in terms of access to SRHR services and protection from exposure to conflict. Thank you for that, Flavia. You are the co-chair of the Lancet Commission on Gender-Based Violence and a champion of these issues throughout your life and career. Where are we going wrong, Flavia? How do we plug this accountability deficit, especially for adolescent girls, and what would you ask us to do differently?
Thank you so much, Rajat, and thanks to PMNCH for convening this vital conversation. I want to, for a moment, for 1 minute of the time, bring the attention of the audience to the plight of those adolescent girls that suffer violence. Through the work of our commission, we have confirmed something that we already knew, that a large proportion of the violence that is suffered by women actually occurs before they are 18. So they are in the most vulnerable period of the time. You mentioned nearly 50% of the pregnancy in adolescent girls, 15 to 19, they are unintended. They are not necessarily linked to violence, but they are unintended, they are not wanted. And countless girls are facing physical violence. Now the increasing threat of technological facilitated violence, cyber violence, technology facilitated violence. So if that's the situation, Rajat, obviously the accountability is going somewhere wrong. And through the work we are doing with the Lancet Commission, which I co-chair with distinguished Professor Felicia Knoll, we have seen also violence at such early age has a tremendous impact on the health of that population. So it's directly associated with mental health. We have strong association with anxiety, depression, eating disorders, and then we are wondering why we see the peaking of these disorders. And increasingly, we are seeing this transmission of violence through generation, which means if you are affected by violence before the age of 18, you are more likely to accept violence later in life and accept a violent domestic situation for you and for your offspring. So how do we change the situation, Rajat? You asked that question, and it's a question that it's really we need to reflect profoundly. First and foremost, we have to have the data and the information about this violence, the suffering that occurs. And unfortunately, many countries do not have the data. Italy, a G7 country, does not have an ongoing survey for violence against children before the age of 18, and many other countries like that. So first, the data, that is the key. The framework that are being used, that are being proposed, are very, very useful and valuable, but the data have to be collected and have to be used and have to be presented. Second point, which is very, very crucial, is this data has to be not just owned by the health sectors and by the people that are the data guru. It has to be used in a multi-sectoral manner. Because here we are talking about healing, providing services to this population affected by violence, but also justice. We have to provide justice to the ones that have been violated in this way. So the multi-sectoriality of using this data is something that is very challenging. And here we can learn from countries like South Africa and others that have done that. Then the third thing that I would like to really stress, Rajat, is not only policy and governments that have to be involved in this, but parliaments. In democratic structure society, parliaments are the ones that hold the accountability to their own people. They are elected. They are accountable to the people. And they have to report back whether or not activities have happened and whether or not those investments in those services for adolescents that have suffered violence, they ever happened or not. And finally, this is not a secret. I am a strong believer that none of us can do this work by themselves. Not the government, not the professional organizations, not the academic researchers, not the young people by themselves. This is a work that we need to do in partnership, together, holding hands and holding each of us to account. Are we doing our role or not? Are we reporting on the violation that is happening or not? Are we following this up or not? These would be my suggestion, and thank you so much for convening this valuable conversation. Thank you.
Thank you. Thank you so much, Flavia, for that very clear clarion call, not just in terms of the actions that you suggested, but very profoundly as you touched upon the issue that silence on violence against women and girls is not an option. Thank you, guys. As we rotate to the next panel, we do have some time, and we do want to hear some reflections from you as the audience. Comments, questions, reflections. What do you think? How can we plug this accountability deficit, and what will it take? We do have 2 microphones that we can try and capture. I'll try and take a couple of comments together before we transit to the final panel. Avni, please, welcome. And do introduce yourself as you take the floor.
Avni Amin. I work for HRP, Department of Sexual and Reproductive Health and Rights. I lead WHO's work on gender-based violence. I'm also the unit head for the Rights and Equality Across the Life course team, which is where our adolescent sexual and reproductive health portfolio lies. Pleasure to be here and really wonderful to hear. I mean, I'm really impressed with some of the examples. The one from South Africa on social bonds was very, very exciting. Just a couple of reflections. 2 weeks ago, our department produced 2 guidelines for adolescent girls' well-being. One was on adolescent pregnancy and poor reproductive outcomes, which focuses on recommendations for child marriage prevention, contraception, and comprehensive sexuality education. And one of the things that I think we have to really highlight, and I'm glad to see young people here, we profiled 2 stories, one from Nepal and one from Colombia, about the leadership of adolescent girls. And I cannot tell you how much we need to invest in the leadership of adolescent girls, not only for accountability, but the stories from Nepal and Colombia will show you what an amazing work they're doing. We had girls as young as 13 who are working in these very poor indigenous communities doing sexuality education. They haven't had a single teen pregnancy in that community in 10 years. So just maybe highlighting how important adolescent girls' leadership is. The second thing I just wanted to flag, and I'm glad Flavia talked about intimate partner violence and violence against women. We have produced, last year, The Lancet produced a really data estimates from WHO on intimate partner violence for 15 to 19. And we're looking at 19 million girls in that age group, or 1 in 4 already experiencing IPV, with child marriage being a huge risk factor. And I think we have to do more on violence against girls. I'm making a plug for it because I lead the portfolio in WHO, but this is the one area where there has been very little progress made in the last decade. When in fact we have made progress in child marriage and other areas, but not on violence against adolescent girls. So just a plea, please pay attention to this issue. It's affecting millions of girls. Over.
Thank you for that, Avni, and for that resounding message as well. We do have scope for one more comment or question, if colleagues might want to take the floor, please. Over at the corner. Dina, that was next to you. Yeah, okay. It's a very long roving mic. It'll get to you, Diana. Yep, there you go. Please introduce yourself.
Hi, everybody. My name is Dina. I'm from Indonesia. I'm working with the Yield Hub. Yield Hub is practically, we're trying to convene a lot of organizations, including youth-led organizations, to discuss and solve the problem around SRHR. So I don't have questions because I also came a little bit late. I'm so sorry. But like, it's a reflection, especially when Flavia mentioned around the issues of data. It's like, there are a couple of sessions that I attended, and we would like to emphasize around the lived experience as the data itself. Because sometimes there are a lot of people owning the data, but it's not talking about in the qualitative way. It's not talking and approaching in the people perspective way. It's really important to bring more lived experience people. In this case, for example, also mentioned about the young people in the community that maybe couldn't even attend the session like today, and then you guys try also to make it online, and then the accessibility in everywhere, in every places. But also another thing, I think data is something important, but not sexy. I would like to say that because not a lot of people love reading the data, reading the number. So I think it's important to bring forward the friendliness of the data, how to capture and also transform the data into something more easy to be understood by a lot of different people, including also maybe young people. I don't know. For my case, I do the Sexdugram. It's comprehensive sexuality education on Instagram. There are a lot of terminology on CSE that has been produced by UNFPA or other UN bodies. But then, in what case that young people in Indonesia would like to learn about sexuality education? Maybe some people think that, oh my God, this is something haram. Why you are learning about sex before marriage? But then we try to switch that, conversation into something more like Gen Z and Gen Alpha can accept. So maybe from TikTok trends, IG Reels, comics, also working together with the religious leaders. I think that could be also filling up the gap for the data itself. And also at the end of the day, to hold everybody's accountable is not only working with the parliament people, government, but also I think every single perspective and also human being in this world need to also, understand and have the agency that it's important that they have to work together at the end. So yeah, thank you.
Thank you for that, Dina. And as Flavia said, it is about mutual accountability. We need to hold each other to account, that we change that narrative that Kanisha started us off by saying. Thank you so much to all of you for those remarkable reflections. And may I now invite the next panel, Helen, Andrea, Luke, and Kathleen, to please take the stage. It's my great pleasure to have Right Honourable Helen Clark, PMNCH Board Chair and former Prime Minister of New Zealand, Luke Leviolot, Head of Secretariat, Global Financing Facility, Andrea Studdard, the CEO of Fondation Botsnar, and Kathleen Sherwin, Chief Strategy Engagement Officer for Plan International. Welcome, all of you. You've all been hearing these reflections and some very profound challenges, if I may. And Helen, if I could start first with you, and you've been a very strong advocate for leadership, but also measurable outcomes and impact. So how do we move this from rhetoric to reality, Helen?
Well, big question. I think I always look at this through a lens of having been a minister and a prime minister and trying to get stuff done and where you prioritise and where you take your information and guidance from. And it's clear that there's quite a significant body of guidance now coming through the system from WHO, the work PMNCH inputs into. And I think it's going to be extremely important to socialise this work around the world's health ministries. And let's not assume that every health ministry's got the capacity to be scanning every last document that came from the system. So how do we actually make people aware in the policy making, policy advisory system that these tools and guidance are there? But then the encouragement has to be to actually link to the young people themselves. And the last intervention we heard was very much about seeing the lived experience as a very important contributor to the policy making. It's not just about facts and figures and hard indicators, but what are young people thinking and feeling? How can that be not only be captured, but have them involved in a way that is meaningful? Because what comes out the other end of the policy process has to actually relate to the needs of young people themselves. Otherwise, it's entirely academic. I think there's a broader case to be made, of course, to those who must, finance policy and interventions, and that's to leaders and finance ministers. And it's about this incredible demographic where if the policymakers don't get it right, the cost, as you continue to say, Rajat, is absolutely enormous. If we get it right, we're all the losers, not only young people and their potential, but whole societies are held back if we don't get it right. So I think there's really been some very exciting ideas put on the table in the discussion, and I just feel comforted to know that the tools and guidance is there, but then the challenge is to get it out there and get people picking it up and implementing it in a way that's meaningful.
Thank you for that, Helen, indeed. And this is where, as one would say in the colloquial, the rubber hits the road, and how do we maintain the distance? Luke, you had the GFF and a very important role, and how do organizations like GFF support countries through a systems-based approach to address these challenges, but these rather phenomenal leads that our adolescent and young friends are asking us to deliver upon?
It does work. Okay, great. Thank you. I have to say it's slightly intimidating to be on a panel with Ellen and to come right afterwards, but thanks for the segue, Ellen, because actually that's what the GFF tries to do at least. But first, thanks to PMNCH, where the GFF is very proud to be part of this partnership and to be on the board for the leadership on this issue. I think, and the campaign that we had recently, really impressive, and now to take the issue into this next step on accountability and scale up. The GFF, for those of you who don't know, is it's a global partnership that focuses on eliminating preventable deaths in women, children, and adolescents. And so adolescents are at the center of that. It's based at the World Bank because it has a financing model that is the main lever we use. We have a trust fund that has $2.6 billion of grants that link to World Bank financing and then crowding other financing around national plans. And I wanted to explain that because it explains a bit of what I see as how we can contribute to taking this forward. We have 36 of the poorest and most fragile countries in the partnership, so really working in some of the toughest environments. So what are we, to Kanisha's question, what are we holding ourselves accountable to? I would say maybe 3 words. One is on prioritization. That, Ellen, is what you just outlined. How do you engage with all of this material with governments when they're developing their plans, but also much more importantly when they're deciding on their budgets and how their funds will be allocated. So that's one way in which we engage we help translate the evidence and help in that process of prioritization. But we also, very importantly in a number of countries, along with others, because others have also done this, enabled adolescents themselves to design their own programs. And so that's been important. So the first word, prioritization. The second one, scale. Some of you who know me know that I'm a bit boring on this. It's what I keep raising, but it's really about having these plans at scale, as far as scale as possible. And our role with this grant money that I explained is to help de-risk that transition from really good pilots to something much larger. And then the third word is sustainability. And so in that translation process and de-risking process, it's also about sometimes looking at Sometimes there are Cadillac models out there, that are that were very good in their own constrained sort of environment. But what do you keep? What do what do you let go so that you can actually scale in an affordable way, on budget, but also sustaining through political work, so civil society engagement and youth engagement. So we work with youth and civil society. And last, data, as others have mentioned, but it is an area we work in. Thank you.
Thank you. Thank you very much for that, Luke, and very, very concrete ideas. And going from one donor to the other, Andrea, coming to you next. And these are challenging times. And as resource constraints compound and aid cuts and the fiscal pressures, I'm sure your tray is getting bigger and bigger and bigger, and the demands are increasing. And without wanting to sound facetious anymore, is how do donors in these resource challenging times ensure long-term impact and, as Luke was saying, sustainability, and what do ethical transitions look like in your view? Over to you.
Yeah, thank you. So, is it working?
No, that one is. Yeah, thank you.
So, thank you very much. I think we have, since long this discussion, and now probably the reality just arrived also here, and I think this week we feel it in many conversations you will have, and also because many people of also friends are affected by what is happening, not only in the United States, but also throughout donors. So I think what we always say, and from a philanthropic perspective, is a bit different because you have different funds and you're probably also more reliable to a certain extent, but we can also advocate. So I think long-term reliable funding is one of the basic principles we always pray. We always prayed in the past, and I think we have really to commit it. But it has to be realistic from the beginning, and that's probably something that it's not a beauty contest when you pledge. It's about your commitments. Afterwards, I think we have heard it, sustainability, you said as well, but it's also when we fund its dependency. So we have to think about sustainability, bearing in mind that we create dependencies. So what do we do to somehow in the mid and long term avoid that this dependency stays, because we will not remain forever. And it's not also our goal, and we know it from the beginning. Then about pragmatism, I think we have been, and you mentioned it, about guidelines and also frameworks. They can be perfect or they can be pragmatic. And we have probably to get down a bit like on the pragmatic way, and first to think about implementation. And we have heard it from the young people here and also from the other partners. And then it's about collaboration instead of competition. How many donors, actors, and organizations are being on the field, competing instead of collaborating? Competing about funds, but also competing about space, instead of really cooperation and collaboration. And in the end, this is all about accountability, and we have heard it. And accountability means for us being humble. It's not about us as funders or donors. It's about the people we care. So we really have to focus on that.
Thank you for that, Andrea. That's very helpful. Sustainability versus dependence, collaboration versus competition, and a lot of food for thought. And thank you really for championing this work as well. Kathleen, coming to you last, and I think in that spirit of collaboration and cooperation, what do you see as the role of partnerships, not just PMNCH, but others, in ensuring this multi-sectoral accountability?
Thanks. I'll follow Luke that I'm very nervous because not only do we have our board chair here of PMNCH, but she's also my mentor. So I there's a lot of pressure on me. So a couple of things. In the first part of your question, you asked 3 questions. So the first part in terms of why accountability, multi-sectoral accountability is important on the adolescent health and well-being agenda. When you look at shrinking civic space and how that impacts adolescents, rollback on rights, less ODA, a very unclear global health architecture, it is more important than ever that we are delivering on the commitments that we have made to adolescents, both girls and in that community. And that's also centering global South leadership, that's centering youth and adolescents in that. And the right to health for all includes and must include adolescents. And it's often overlooked, as we know. And it is a precondition. It is a prerequisite for gender equality. It is a prerequisite for sustainable development, and it's a prerequisite for sustainable economies. And so it's more important ever, the accountability piece. Now, if you were at last night's session, I was moderating it, and everyone's homework was to bring some practical examples. So I figure I should do that as well. So I'll bring 3 examples just from plan on what does adolescent accountability look like in a multi-sectoral space. So in 2023, we launched the Translating CSC Commitments to Action with UNFPA and 13 key partners. Many of you are in the room. Last year, we had ICPD 30. We had a global youth dialogue, which resulted in the Contenu Youth Action Agenda. We also launched the Adolescent Girls Investment Plan accountability platform, which works in an intergenerational way to help governments deliver their commitments to adolescent girls and youth. So those are just 3 examples. Just the last piece, which I'm putting back my PMNCH board hat is, and I'm a very proud new board member of PMNCH, is PMNCH's role in the accountability conversation. We are 1,500 members, and in 2023, and we have many leaders here, Flavia and others, that helped launch the Global Forum for Adolescents, the 1.8 billion campaign, which brought to life a number of new evidence and tools, but also commitments. So as we have just approved the new PMNCH strategy, which will be released more formally in the coming period, I will preview that it is about helping to accelerate those commitments that were made for us to be able to really double down on the advocacy required where commitments are stalled and to be able to ensure more accountability overall. And it is doubling down on the multi-sectoral partnerships that deliver this agenda, whether that be the Global Leaders Network or Avini or the Child Survivors Network, IPU, CAPS. These are programs that we know work, and we're really proud in the next strategy that that will be the center.
Thank you so much for that, Kathleen. And indeed, putting partnerships and coalitions at the center on how we deliver change. Enormous thanks to the panel, and may I ask you now to take your seats back in the audience, and a huge round of applause for you. Colleagues, we do come to the final segment of our conversation today, and may I now request 4 dear friends from organizations, co-conspirators and partners, Samu, Eman, Yasmin and Saima, to please come on the stage for sharing their closing reflections. This is a very polite closing session. We are missing one. Saima. Thank you. Oh. Thank you. Thank you all so much. You've heard a lot of ideas, a lot of anger, but a lot of reflection as well on what needs to be done. I have the same question to all 4 of you. One thing that you think you and your organizations will do based on the conversation you had to advance accountability for adolescents and young people. I will start with you, Samu, and then come to Yasmin and close, and Eman, and then Saima.
It's a tough one, right? To be asked what you're going to do, but acknowledging that adolescents don't just need one thing. They need SRHR, they need access to employment, they need all these things. For FP 2030, we have launched a campaign that says made possible by family planning. This is not a hammer that is going to fix everything, but we know that ensuring one controls their own sexuality, ensuring that there is access to reproductive health and contraception does solve many issues in one's life. So here in this room at the back, you will see we do have the Made Possible campaign. Sign up, share your stories. FP 2030 is providing that platform to ensure that many young people have got access not only to those stories, but they will also share knowledge. The other thing, and I know you said one, but financing this issue is also going to be important, Rajat, because we cannot move forward decisively without ensuring we carve out money, time, and resources to ensure that this is going to happen. FP 2030, working with our partners, whether it's GFF, PMNCH, we are intentionally ensuring that all these innovative financing mechanisms, they all have SRHR in mind, and they do have adolescents in mind. Expanding whether it's their access to private sector, expanding models of care, but ensuring that they are at the center of what we are going to do is even engraved in our strategy as FP 2030.
Thank you for that, Samu, and thank you for partnering for this conversation today. Really remarkable to see the advancements FP 2030 is making under your leadership. Yasmin, over to you from UNICEF perspective.
UNICEF is a proud partner of the PMNCH Forum, and I think it's to echo the importance of this partnership because it brings together organizations who have presence not just at the global level, but also importantly at the countries, where we have the constituents and adolescents, young people are core to the work that we do. And I think I would focus on the data aspect and really to say that we truly believe that data is not just numbers. It is that lived experience that our young friends have reminded us about. It's also important that we bring their voices to the different fora, and that's something as an organization, it's extremely important that we bring the voices of young people to every fora that we have. And I think finally I'd say in terms of going back to that accountability, the accountability of, so what are we doing about it? Are we showing the courage to prove? And I would just end with reminding us of what we heard from Kanisha, that are we holding the mirror up? And I think that's an important part for us, definitely, that we hold the mirror up and say, are we being accountable? Are we bringing in the voices? And are we making a difference? So, yes, that's the commitment we would make.
Thank you so much for that, Yasmin. And indeed, we need to be holding the mirror up for each other. Ayman, UNFPA.
Thank you, sir. Excuse me. And good evening, everyone. And again, thank you very much. We are always, on behalf of UNFPA, we're always honored to be part of the PMNCH partnership. So I was thinking how I can frame my closing, because should I be open because closing should be closing on a positive note, or should I be realistic? So I will try to be between both. So let's start with the data, because again, you said what are we going to be accountable for, and you as well, sir. Data, we know the problem, we know the stark reality that almost one adolescent girl in every 5 dies from maternal-related causes, which are preventable. These are data, but again, if I may reflect on my personal experience in my earlier life, as an OBGYN, and you see this teenage girl, this adolescent girl who got pregnant without even knowing that she's prone to getting pregnant, and she's about to deliver, and she's being completely shunned by her family because of the stigma and the disgrace, and she's just there on a side bed in the delivery ward. She does not even give herself the right to shout or to scream because of labor pains, because she herself feels that she's stigmatized. You see only one young girl of these, and I have 2 daughters, and you see one girl, and I remember them till now, that was like maybe 40 years. This is very painful. So when we talk about data, we are not talking about statistics. We are talking about real people who could have easily been you or I, or our daughters or our sisters. So it's really painful if we do not take action. So back to your point, Kanisha. What is it? So when we speak about accountability, we as UNFPA, we are accountable to ensuring that sexual and reproductive health and rights is going to be ensured and delivered and implemented in each and every country program document we support the governments to implement. And when we say accountable and we say country program document, and again, I don't want to repeat what other panelists have mentioned, we will be adopting a multi-stakeholder approach, a multi-sectorial approach, because ensuring sexual and reproductive health and rights is not only a health thing. It's a social issue, it's a bodily autonomy issue, it's an economic issue, and it's an educational issue. So we cannot simply consider sexual and reproductive health as a health issue to allow sexual and reproductive health services or comprehensive sexuality education to be accessible. It's not going to serve anything. Unless we make sure that governments adopt policies that empower adolescents to be educated, to learn, and to have access to information, and to have the bodily autonomy to make informed decisions about their bodies, about their fertility, about their sexual activities, we will never succeed. So again, on the positive note, we know what the solutions are. We are accountable to achieving it. So may God be with us to achieve it. Thank you.
Inshallah. Saima, to you, Regional Director, Southeast Asia Regional Office for the World Health Organization. What are you going to do?
What am I going to do? My goodness, everything possible, everything and anything possible. Well, you know, I think what needs to happen first is we take all of us here and we use this as an opportunity to really work together in collaboration and take some concrete steps. Because as we've clearly heard from everybody, there are various aspects to it. There are many voices, there are many tools, many ideas that are fledgling ideas. Some are innovative, some are complex. There's data sets that are being counted, some are not being counted. So it's going to take all of us to really work in a way that we haven't done in the past, work with our opportunities on the ground, and at the same time work with the policymakers, because there are religious beliefs, there are social, political limitations, and we have to find avenues to change. Because you know, I'm a mother of 3 young women. My youngest is just turned 16, and I live in fear. I grew up not understanding and being taught about my own sexuality. I know where the gaps exist because I lived it. I know what a young woman has to go through and navigate from a very personal point of view, because I saw them growing up in this world. And they continue to be faced with the challenges, whether they have the education and resources or not. They live in this is the world we live in. And of course, we also have the digital world, where what they're exposed to, the violence isn't just the violence here. It's also violence that is being taught to be acceptable. So for the Southeast Asia region, we've developed a roadmap. And in the roadmap, one of the key elements is about women and girls. This year's theme for the region is adolescent health. And in part of that effort, I recently went and spent several hours with a group, the Youth Program Foundation. And, you know, sitting with young people, 30 young people together and engaging with them, you realize they are such a wealth of information and knowledge. And there's such diverse needs. They may not be able to see the commonalities. They may not always see where the interconnectedness are, but we can, because they bring those ideas. So creating opportunities where we learn from the people, the individuals who are actually experiencing the challenges and solutions that they're coming up with. Concerns that we may not even think is a big concern, is a concern for them, is a reality. You know, they are part of this this group, this teaching them to be activists, this teaching them to speak up, they're learning about the policy, and yet they go home to their families where their own sexual identity isn't accepted, where their families, for their own religious, social, cultural beliefs, cannot accept them, and they're breaking down inside. So here we have young leaders, we're teaching them, we're using all the tools and programs that we have, and yet we cannot get them to feel safe in the place they're supposed to feel safer. So there is a lot of work we can do. We can make health systems more resilient, and I can do that from my part. I can talk to governments, I can have the policies, I can have the roadmap, I can have the solutions, I can talk to the policymakers and convince them it's an important area to work. But I have also have my limitations, you know, just like each of us has our limitations. And we're working in silos. We need to break those silos. That solution has to be multifaceted. It has to be multi-sectoral. And those are fantastic words. I love using those words. But what does that actually look like? It actually looks like we're sitting down and saying, okay, you know what? I can do this, this, this. And you can do this, this, this. But there's these little gaps. Who can fill those gaps? How can we fill those gaps? And so the solutions are there. The very good solutions. The motivation is there. And just taking that opportunity, we're thinking a little bit outside the box, finding a way to bridge those gaps. And that's what I hope to do.
Thank you for that, Saima. And that is indeed incredible, because multi-sectorality is what makes Partnership for Maternal, Newborn and Child Health what it is. Colleagues, I'll not dare summarize the evening and the conversation we had, but there are a couple of things I want to say in response to Kanisha, where you started us from. We must do better. We must translate these guidances, these toolboxes, these roadmaps that we have into a reality. And quite honestly, if not now, when? Funding is not an issue. Intentionality today is the issue. And the question is, are we going to stay the course, or are we going to abandon the young people yet again? And I do go back to the point that Flavia made. It has to be about justice. It has to be about human rights. If not, we are failing each other and our future generations. A big thank you to all of you for joining us today, and a very big thank you to our dear friend and colleague, Anshu Mohan, who has made this possible relentlessly over the years, including this evening. So a big round of applause to Anshu and the team PMNCH. Thank you. Thank you all very much. Do enjoy the reception.
As a young person, I need good and quality education and support from my parents and whoever is related to my school education.
Lo que quiero para mi bienestar ahora es un país seguro para mi familia, para mí y para mis seres queridos.
I need to have access to free sexual reproductive rights services and the available youth-friendly healthy corners in our communities.
My dream in life is to have a successful career where I am in a position to help others and make change.
I think as young people, we don't want to stop. We really want to talk about our rights and our opinions, and to be able to get platforms where we can really voice our concerns is the biggest thing that can happen to us.
Our goal and our wish is to have more young people in decision-making processes. Unfortunately, we have a very low participation of young people in these tables of decision.
Hola, mi nombre es Nico Gómez, tengo 23 años, soy síndrome de Down, soy deportista de alto rendimiento. Vivo en Bogotá, Colombia. Mi sueño es ser campeón mundial de mi país de paranatación. Quiero pagar mi seguridad social, tener independencia económica.